going about dry eye and getting people connected, especially during this very disconnected time. So today we're going to be talking about dry eye and mental health. It is a great, big, huge, gigantic topic that I think is relevant for pretty much everyone in some degree or another. So first we're going to have Aiden walk us through a couple of Zoom tips. Then we're going to have all our panelists today introduce themselves. Then we're going to head into our Q&A about dry eye and mental health. And in about an hour or so, we should, we'll then let people have their audio and video turned on so you can join in the conversations on this. Aiden, over to you.
All right, just a quick look at the controls here. For everyone who's watching from home, you have 3 buttons at the bottom. You can chat with us or you can chat with everyone with the chat button. You can raise your hand. We might ask questions or do a little kind of poll thing. And then you can also ask questions during the meeting, and we'll go ahead and answer those after the kind of panel portion is done. If you have any questions for me, feel free to chat, and I'll do my best to help out. All right.
Okay, so we're going to start with Christina. You are our newest on the panel. Thank you so much for being here. So we're going to have you introduce yourself by telling us what state you're in, geographically, what beverage you're drinking, how long you've had dry eye and why, if you know, and where you're at in your journey now, and what eye drops you used last.
All right, great. So as Rebecca said, I'm Christina. Geographically, I am based in Columbus, Ohio. Mentally, I don't know. I've been I've been trying not to drink coffee this week, so I've been pretty tired and out of it. So let's see, my dry eye journey started, or my official diagnosis was in 2017. I had kind of suspected that something was going on with my eyes. I had, as a chronic contact lens wearer, I have reason to believe that my issues are a result of my contact lens abuse, if you want to call it that. I would wear them for extended periods of time since they were advertised as 24/7 lenses. I didn't think much of it because I was in the 18 to 21-year-old range. I'm in college. I just wasn't thinking about taking care of my eyes in that way. So then after I graduated, grad school-ish, maybe 23, 24, I started noticing I'd wake up in the middle of the night with just a searing pain in my eye. It wouldn't happen every night, but every couple of weeks I'd get that pain. And that's when I started thinking something was probably going wrong. So I switched mostly to wearing my glasses full time. And then at that time, I was living in Nashville, made the move back to Ohio. I'm originally from the Cleveland area, landed in Columbus, and that's when I decided to seek out answers for why my eyes were itchy and burning and all these other fun things that we get to deal with. I think that's most of the questions. What beverage am I drinking and what eye drops did I use last? I'm a big fan of canned bubbly rosé, so that is what I'm drinking today. I don't know that I'm partial to this brand, but nevertheless, it's a good stand-in for my normal, which is Underwood, in case anyone's interested. And then last eye drop I used was my Retain MGD. I use this as my daily eye drop, so I'll do those every couple of hours to keep things lubricated.
Okay, I do know how to unmute myself. Thanks, Christina. I can so totally relate to the whole contact lens abuse in that age range. I mean, I started wearing contacts when I was in the 6th grade, and in my teens, I got a little wanderlust and I moved to Greece. And I didn't want to think about how I treated my eyes in those years, kind of 17, 18 to 23 or thereabouts. It's like, wow, I just wouldn't have had any idea what that could mean. Mm-hmm. All right, let's see, Laura, I guess for those of you who have been here before, maybe the truncated version, but go for it. Introduce yourself.
Yeah, if I go through my whole organ recital, it's going to be an hour and a half of me. I'm in Washington State. I'm drinking iced coffee as per usual because I just can't give it up. I know it probably doesn't help, but it helps me mentally. I've had eye issues of some form or fashion for probably about 15 years, maybe. In my dry eye journey, right now I'm in a good spot because I got my scleral lenses not that long ago. And I'm happy with them, and they've been a real game changer for me, as I know they have for a lot of people. I know they aren't for a lot of people too, and that's okay. There's lots of other things, but for me, this has been super helpful. So, and this is after, multiple Procaras, serum tears. The serum tears help, by the way. Serum tears, Restasis. I've had multiple surgeries. I've had a lot of eye stuff. So, but right now, what's working for me, and I'm happy with it. Let's see. What eye drops did I use last? Well, my serum drops in the morning before I put my lenses in. But now that I'm wearing the sclerals, I'm not using eye drops during the day that often. I was using them very, very, very frequently, but I find I'm needing them a lot less. So that's where I'm at.
Hey, thanks. Rob?
Hi, my name is Rob. I am in Queens, New York, Long Island City, just directly across the river from the UN building. And I am drinking water because it's going to help me stay awake for the next 4 hours. I had LASIK surgery in 1995 when it was still a relatively new procedure. Sorry about the beeping, I'm trying to stop that. And then between 1995 and 2006, a total of 7 cornea surgeries, a total of 7 refractive surgeries intended to correct and repair things that happened the first time around, all of which left me in with severe MGD, as well as a lot of refraction issues, high order aberrations. And from about 2006 to 2010, I spent a lot of time visiting doctors all over the States and in Europe, and going to conventions and trying to figure out what was going on. Eventually connected with a wonderful doctor in Boston whose specialty is MGD. He has been taking care of me for 10 years, improved my situation in my life a great deal. I'm somewhat sad right now that he's not seeing patients because of the pandemic, but and I wear scleral lenses, which I got from the Boston Foundation for Sight, and which Rebecca helped me make peace with a long time ago, and come to have a great deal of appreciation for. So that's the short version, I think.
Great, thanks. What eye drops did you use last? And where's your cod liver oil?
Hang on, Rebecca.
You
Don't
got
go
too much to drinker last time I saw you.
The last eye drop that I used, actually, Rebecca and I just had a conversation about, okay, when I did this a couple of weeks ago for the first time, I decided I would try to be funny and tell people I was drinking cod liver oil. I actually do drink this straight from the bottle now because I am lazy, and having MGD or wearing scleral lenses, as you guys all know, becomes such a complex, you have so much stuff, plungers, cleaners, vials, everything, that I've been on a mission every year to just try to minimize as much as I can. And if I don't have to clean a spoon, that's one less thing I have to do. So you take it off, nobody's around, I don't care, you just chug it. It tastes like lemon. You don't get any fishy smelling burps. It's really good. But I did it this morning, so I'm with water now. The last eye drop that I used, Rebecca and I actually discussed about a week ago, and I won't elaborate on it because it's still a bit of an experiment with me, but it's Regenerize. Rebecca, can you fill in the blanks for me on that, on what it is? Because I know it attempts to address inflammatory proteins, and that's about where I'm at with it.
Oh dear God, and I'm no further. You know
can
how
skip
horrible
it.
I am on technical stuff. Amniotic fluid, voodoo, I don't know.
Yes.
But it's supposed to be helpful.
Yes, and it is because my doctor, because I am working with a new doctor in my normal doctor's practice. She has some really great ideas for minimizing the amount of preservative, for minimizing some of the stuff that I'm doing. All of the over-the-counter medications, Sustain Gel, Sustain Balance. I take Restasis. She sort of looked at, and I use Soothe ointment at night. And she sort of looked at what I was doing, and she said, you know, there's probably a way to cut back on some of this. You're doing a lot. I was even I'm filling my scleral lenses with Celluvisc and Purelens, or Celluvisc and Neutrophil. And none of these are particularly, necessarily dangerous, but it's just a lot. So we are in the phase of my illness now where we're doing a little experimenting and seeing what we can minimize and cut down on.
Okay, I love that. Minimalist is what I'm all about personally. It's like, what can I exclude? There's just so much stuff. And harking back to Laura for a moment, the whole iced coffee thing, I'll tell you what, I don't care what coffee does or doesn't do for dry eye. It's a quality of life thing. Quality of life matters, period.
Have you seen me on the boards? People have asked about them on some of the Facebook boards. And I'll say I'm not willing to try. So it's
right on. So I'm with you there. Okay, Mandy, your turn.
All right, so this is my third dry happy hour, so I'll be pretty short. If anyone has any questions afterwards, feel free to reach out to Rebecca and get my contact information. I'm not afraid to talk to people. You can also see I'm pretty fidgety, so sorry about that. Maybe that's part of my mental health issues. I don't know. But I live in Madison, Wisconsin, and it's been so humid lately. It's crazy, but I insist on sitting outside because I love the humidity on my eyes. And I am drinking because, like Rebecca and Laura with their coffee, I'm not giving up booze. I just really I'm from Wisconsin, come on. So I am drinking a local, I always try to bring a local beer in here, and this is very local. It's like from a couple blocks away. It's called Giant Jones Brewing Company. I got it from my neighbor. It always has this like weird label. Like, I think that's actually pretty good for today, the one-eye dude. So it's a double IPA, bottled June 15th, and it's 9.3 ABV. So I may be getting happy. I don't know. So I've had dry eyes since I was 19 and I'm now 43. Have absolutely no idea why. Still have no idea why. Still get many blood tests done here and there to see if anything's changed that could give some sort of inclination as to why, but nothing has shown up. So where I am in my journey, since this is a mental health subject, I will say that I'm working on acceptance on a daily basis because it's not going to change. I mean, maybe there will be new treatments coming out that make it more comfortable, but this is what my life has become. And I know there are many people who have things a lot worse. And I just try to look at it in that context. I try to do what I can to make my eyes feel good, meaning no makeup, hardly any creams or lotion, unscented things, wearing my moisture chambers, doing my compresses, putting in my drops regularly, and a gazillion other things, as you all know. So that's where I am. The drops I use last actually are the same drops I had just opened on the last dry happy hour. And I just started this, and I was saying on there that you're supposed to be able, it's retain HPMC, and it's supposed to last, well, it can be open for 90 days. I think I'm literally on my last drops. That's how, because we have to use drop slot. So 2 weeks, which is great. So anyway, look forward to more conversation.
How do you like that HPMC?
I like it. I guess I don't think I liked it this time as much as my first bottle. I've gone back to my Refresh Plus, which for me is just the most comfortable. And it's probably because I have more aqueous deficient dry eye. I mean, I do have some MGD going on just because of the years of aqueous deficiency has created much more inflammation. But Refresh Plus, I mean, even if it doesn't last that long, it's the one that tends to irritate my eyes the least. I have not tried the Regenerize, which I think, isn't it more like, supposed to be like serum tears, but it's made from the plasma, so you don't have to go in and get your blood drawn, and it's supposed to work across the board. I haven't tried it yet. A doctor recommended it to me, but who knows? What?
I'm sorry to interrupt. It's far afield in the general sort of nucleus of things that people will try. This one was kind of a, out of left field, but I'm stable enough that I wanted to give it a shot. So.
Well, yeah. Your experiment and your N of 1, Rob. Fingers and toes crossed that it goes well.
Yeah, I'm willing to try lots of things because, I mean, granted, I'm going to say don't try a gazillion things at once because then you don't know what's actually working and what's not. So, all right, I'm done.
All right, great.
For real.
Me briefly, Washington State. What am I drinking? I'm drinking water and a two-fisted drinker again. Water and a fairly cheap rosé of some kind, which probably tells you everything you need to know about how I handle the mental health impact of eye stuff. How long have I had dry eye? It is 19 years and a bit right now from LASIK. Like Rob, where am I at in my journey? Stable for the most part. Flare-ups, bad times, dealing, whatever. I'm kind of trying to face down cataract surgery sometime this year in hopes of being able to drive at night. Eye drops that I used last. I don't really use drops a whole lot, but I have a vial of Neutrophil in front of my computer that I use to douse my scleral lenses every now and then when they're bugging me, particularly at work. That's where I am at. So, dry eye and mental health. Today, that is our great, big, huge, giant topic. And honestly, I feel like we need about 13 dry eye happy hour sessions to really talk about it because it's big. For me, this is actually everything. This is why I'm passionate about everything that I do. This is why I started the Dry Eye Zone back in 2005. That's why I started the Dry Eye Shop. It's why I eventually started the foundation. It's because our biggest, hardest battles, I think, are won and lost not on our corneas, not in our meibomian glands or anywhere else other than in our heads. It's a big deal, the impact that this thing has on us emotionally, mentally. For me, this goes back to 2001 when I had LASIK in July of 2001. And when I had issues, and I mean, my big issues were vision issues, but I also had a lot of pain. And my personal orientation is vision first, comfort second. So vision was always the driver, but pain was like the icing on the cake. It's like I can't see and I hurt all the time. That's what made it really, really bad. So when I was having issues, one of the first things I did after I got to a point where doctors just weren't helping in those first few months, I went online and This is nearly 20 years ago. There just wasn't very much online back then. You search things on Google and you might get 25 hits, not 25 million. It was just a really different time. But there was this forum called Surgical Eyes. And I know there's going to be some people here, hopefully, that will remember Surgical Eyes. That was like the saving grace for a lot of us. It was where everyone who had these post-LASIK and post-RK issues were congregating. And so I went there looking for information about my eye problems and trying to figure out how I could find better questions, find better specialists or whatever. And the first thing that struck me in the forum was just, there was so much distress. There were so many people having this incredibly hard time. It wasn't just a physical problem. It was really messing with them in really big ways. And of course, at the same time, I'm going through all of my own struggles then. But that's the thing that just got to me. And this is back when I was working in totally different stuff. I was in aviation finance and nothing related to eyeballs at all. But that's what pulled me in and got me into a groove of wanting to help and find ways for people to get better solutions for their eyes and try to gather information together and try to connect people together that can help each other. In 2003, I experienced for the first time the suicide of someone with dry eye issues that I really cared about and was trying to help. In 2004, I had an experience where I had husband and wife on two different phone lines. The husband was suicidal. The wife had no idea. I had to bring her up to speed in about no time flat on what was going on and why. And I was going back and forth between the two of them on these two lines, trying to persuade both of them that he really needed to be hospitalized. Hardest conversations I've ever had in my life. I was probably shaking for a week afterwards. Thankfully, great outcome. He was hospitalized, got better. I was able to visit them later, both when they had their first baby. Sunday, 2 days from now, I'm going to be meeting with a couple who lost their son to suicide because of dry eye. These are extremes, obviously, but it's the nature of the distress that can lead to those extremes that is what gets at me and tugs at me. And I think that distress in smaller degrees, in different ways, is something that affects all of us in our dry eye journeys. That's what we're going to be talking about today, not suicide. And I don't mean to be a huge downer. I'm trying to frame this in terms of, here's why I care about this particular topic so much. I want to read you something that I wrote 13 years ago on Dry Eye Talk, the forums. This was before the Facebook groups got going and things. And it was kind of just one day I had this massive emotional outpouring of, here's my kind of sum total of what are we all as a community going through. So I'm just going to read this and then we're going to jump into our Q&A. So here's what I wrote. There is a dark, dark place where many of our members have been during some part of their dry eye journey and where some of you are right now. It's a place of shock, of deep depression, of sometimes paralyzing anxiety. It's a place where you're consumed with fear that things will never, ever get better. It's a place where you obsessively compare your situation with the others posting on the boards or groups as we have now, alert to every shred of similarity between your situation and that of someone else who's been here perhaps for years and not gotten better. You're desperately trying to find some strand of hope that there's someone else like you that has gotten better. But since the ones who do get better don't hang around boards or groups, you don't see them, so they don't exist. It's a place where you read the boards or groups daily and become oppressed by the idea that you're not handling it well, that there are others much worse off who are handling it better. It's a place where some of you are consumed with guilt over things you think you could or should have done differently that might have prevented this, or guilt over the impact on your loved ones. It's a place where in your imagination, you live the entire rest of your life in advance, subject to the same intensity of suffering that you're experiencing right now, and that picture terrifies you. It's a place dominated by fear, fear of continued pain, fear of permanent change to your life, fear that your eyes won't ever be attractive again, financial fear, occupational fear, family fear, fear, more fear. I feel like a lot of that encapsulates things that our community goes through in all our different ways. All right, time for our questions. Question number one is, how would you describe the biggest emotional hit you've taken in the course of your dry eye journey? And Christina, I'm going to ask you to field that one first, if you would.
Sure. You know, for me, after the diagnosis, and, you know, I will probably end up sharing in a little bit as far as how that diagnosis is handled, the words that are used, how you're spoken to by a doctor. Anyway, after the diagnosis, taking in the words that were told to me, I mean, at the time I was already dealing with a lot of anxiety that I hadn't gotten counseling for. So that just took me to 100, you know, in terms of my anxiety, and on top of some other personal things that I was going through. And so for me, it again, on top of some of the other issues I was already dealing with, I would have panic attacks, as I'm sure many in our community are familiar with. And I'd never experienced panic attacks to the severity and degree that I was. I know my boyfriend can speak to how hard they were. I mean, I would just get trapped in these emotional cycles where I'm unresponsive because I'm crying and heaving because I'm just so overwhelmed. And to go back to what you read, I think there's so many parts I was taking notes. I mean, so many of the words that you used, like guilt, and distress and things like that. I mean, I think we can all identify ourselves in parts of that, that what you read. And in my case, at that point, it was like all of those things all at once, the flood of trying to process what this meant for who I was going to be the rest of my life. And you touched on the occupational side of things. Like, here I am. I love the work I do. It requires full-time computer use. Does this mean I'm like someday never going to be able to do this job? I love what I do. I'm getting paid to do something that's fun. That's scary. I don't want to have to think about what a different career path might look like. So, you know, questions like that start going through your head. So anyway, that for me was, you know, the emotional hit that I took in my journey, and fortunately, with counseling, was able to for the most part, you know, find some coping mechanisms that work for me. So I happily, you know, I'm not experiencing those extremes anymore. So.
Well, thank you. Boy, can I relate to the job part of that. When I was at my worst, it was like, I loved my work, and it was computers nonstop and frequent international travel, flights, all that. Yeah.
Yeah.
All right. Rob, you want to take this next? Biggest emotional hit? Just like,
yeah, and it's going to continue on the career thread that you've been talking about. I had, I'm a journalist. I'm now a part-time journalist. I had worked my way up from a small newspaper to a medium newspaper to a large newspaper. It's not a very healthy industry. The demands were always, you know, it was always, you know, do more with less, as they said on The Wire. It really was sort of a 24/7 kind of thing. And I had stopped being able to be a 24/7 person on a computer. There were just, it wasn't that there weren't days, there were some days I could do it, there were some days I couldn't do it. And I was extremely happy in that job. It had been a childhood dream, and I did not, I went out on disability from there in 2009, and finally formally left in 2011. And there was I was clinically depressed for about 2 years after that. Very aimless, very directionless, very feeling sorry for myself. And, but it turned out to be a period of my life where I needed to have time to sort of figure out what was gonna get me back to some degree of what I was doing. And that's what I did during the years after that job ended. But far and away, it was losing my job as a reporter.
It's huge. For those of us that just really, really identify with what we do, you know, I'm just going to jump in with one of my memories of a big emotional hit, and not so much a kind of big picture thing as just an in the moment thing. This is sometime in 2001, and it wasn't even, I don't know that it was specifically dry. I was more on the vision side, but it was, I traveled a lot with my old job, and I was in New York where my company had a New York office. So I was hanging out there for a while, and I was having a really hard time. And I talked to one of my colleagues, and it was somebody who kind of knew everybody there was to know in New York. And he asked me more about what I was going through. And then he right then and there got on the phone with some friend of his who was some hotshot ophthalmologist somewhere and said, "Hey, I have this friend here who needs to get an accurate diagnosis under this, and this circumstances. Who do I send her to?" And he gave us a name. And so I called up this office and walked, 10 blocks down the road and went in and saw this guy who was incredibly knowledgeable. And he did a little testing and stuff. And then he basically said, "Here's what's wrong. There is no technology that can fix you right now. Eventually, maybe there will be. Here's a couple of things you can do in the meantime. But yeah, you're kind of just screwed." And I'm a pretty no-nonsense person. I like straight talk. And somehow I managed to convince myself that it was a good thing to be communicated with this way, right? So I walked the 10 blocks back to my office. What was this? 40 something in Lex. This is way back. This is 20 years ago, Rob. And whoever saw me when I walked in the door looked at me and they said, "Rebecca, your face is gray. What happened?" And it didn't even dawn on me that something had really messed with me somehow in that moment. Just something about the abruptness of having this information communicated to me, that where I thought I had this short-term complication of LASIK, really, I had a long-term thing and no idea when there would be some sort of solution for me. That was a big hit, only I'm not sure that I was even emotionally healthy enough to appreciate how big it was at the time. Anyway, so that was me. Who's next? Mandy, go for it.
I guess when I was thinking about the one specific moment in time, I don't really think there is one specific moment in time, because I think it's a progression. You can have like a good year, and then all of a sudden something will happen where you'll have a bad 4 months, and you're like, "Oh great, what is my life going to be like?" And I think we mentioned the career aspects. I was involved in everything. I mean, mine hit when I was 19. So I'm going to talk about high school a little bit, not to be that person who's like, "Oh yeah, we won state my senior year." But more in the fact that I was very driven, definitely a big athlete, involved in every club in school, had really high aspirations, was always busy, got up at like 5, went to the gym, you know, did stuff all the time. And then when I was 19, this started, and it's just got harder to get up in the morning. I find it really hard. Even if I go to bed at like 9 and try to get up at 5, there's just something about that 5 that doesn't work. It's like I have to get up at 7:30. And more that impacts my work because I like to get stuff done in the morning. So then I get into work really late and I stay late. And it's just like this whole compression of trying to fit everything into a day that I used to fit into a lot longer of a day because I could stay awake longer and not have to deal with the eye issues. I mean, I went to law school and I was like, I'm going to be this big environmental attorney and, you know, I am going to change the world. And then now it's just like, got to get through today. How do I get through today? And so it's been a really, and it still is a day-to-day emotional issue. My husband is always like, just stop reading, stop using your eyes, stop, you know, doing this. But I'm super curious. I want to read about everything. I want to know what's going on. I want to be able to talk intellectually about it. And I just have to realize I can't, or I'm going to make my life worse. Now, I haven't quite gotten there every day. Most days, probably not. I still do way too much, more than I should. I should take more time to do meditation. I should take more time to do other things. But back to the point of the question, it's an evolving thing because I guess maybe when I was 19, 20, 21, 30, 40, I still have, what's it going to be like when I'm 70? What if I have to have cataract surgery? Am I going to be able to even function? You know, should I just have my eyelids sewn shut and be blonde? You know, like just so many things that I think about. How it's going to impact life down the road. And I have to really put those thoughts aside and try not to think about them. I think that is the one hardest thing about this. Not that there was one incident that brought it on. There will be days I'm able to block it out of my mind, but then something will happen where I'm just like, this is going to be horrible. And what's down the road? Like I notice like conjunctival chalasis, you know, starting, like I see these wrinkles in my eye when I blink and my conjunctiva, and I'm like, oh great, am I gonna have to have surgery for that? And when am I gonna have cataract surgery? And when am I gonna have this surgery? And how is that gonna make my eyes more dry? And, you know, and then sometimes I think, well, my eyes are so dry already, can it really be much worse? Like I already know how to cope with that to a certain extent. So I'm not gonna go through that phase at least later. So anyway, I can stop talking. Someone else can talk.
I love that thing about just the thoughts of the future and how we put them aside and focus on now. You know, that was actually a path that was really critical for me when I was in the biggest kind of thick of it with both vision and pain and dry eye and all that back in 2001. And I was like, I had LASIK in July that year, and in September, I was in New York for the week of 9/11 that year. And long story short, I ended up getting seconded to my company's London office starting January the next year. And then it was while I was in New York that I had that visit where the doctor said, here you are, you're screwed. And I'm like, wait a minute, I've just committed to this international move. And oh my God, now I don't know what's going on with my vision. And I don't know what's going on. My eyes hurt so bad all the time. And I had to very consciously say to myself, okay, there's some big picture issues I can't deal with here. Forget it. I am dealing with the next 6 months, period. What do I need to get through an international move and changes with my job and this, that, and the other while having all these eye problems? It was just a shrinking down of perspective. And I think since then, more so, it's like, forget the next 6 months. It's like, how do I get through today? Just those shifts are really something. Laura, anything you'd like to add to this topic of kind of the big emotional hits?
Well, for me, because my problems came on so gradually, I mean, just to get into a little, I can't really talk about it without explaining the diagnosis. So initially I had bilateral pterygiums that were removed. And my understanding was I had the surgery, I was done, and off you go. Then I had Salzman's nodules come up, and then which started to become visually significant. And then corneal filaments started happening. And then I got a diagnosis of limbal stem cell deficiency. And so it's basically like a cornucopia of ocular surface disease, overall. But because for a long time, I didn't myself even know how bad it was, but I remember one of my doctors in Chicago before I moved here, he said to me, I'm sad to see this in someone so young, but I didn't even care that he said it. I didn't even think it was that bad then, because it wasn't that bad. Now I understand what he was saying, now that I've been through a lot more since then, but that comment was made about 11 years ago. I wasn't even alarmed enough by the comment to ask him what he meant, which I would obviously love to do now. But what became the most emotionally significant for me was after just moving here, I realized I wasn't able to drive at night. I think because Chicago was so bright, I think that was compensating for at least some of it. And then moving here, I was like, I can't see, like I can't drive at night. And that's what led me down the whole road to, finding the right doctors and getting to where I'm at now. But it was devastating because that was a real loss of independence for me. I felt like a burden to my husband. You have no idea how much stuff goes on at night until you can't go to it. I had to start checking sunrise, sunset times if I went anywhere, because if it got dark while I was in there, I was going to have a problem leaving, something I wasn't used to doing. And so a few times I did get stuck in places and couldn't get out easily. So that was really hard. And I truly believe I went through a grief process relative to the loss of driving at night. I'm now really at a place of acceptance with it. I don't like it. I was kind of hoping the sclerals were going to resolve that and just put me on the road at night again. They've definitely lessened my distorted night vision for sure, but no doctor led me to believe that was going to happen either. I have doctors who are very kind, but they're also really honest with me. But at least now if I'm a passenger in a car, I'm not terrified, which is a huge improvement over if I'm just wearing my glasses. So I would say that was the big emotional hit, was once I realized there was actual impact of this. It wasn't just having to, I've had, I think 10 superficial keratectomies and multiple filament removals. And I figured, hey, I can survive a surgery. I can handle that as long as I'm fine after I have the surgery. But once I realized, no, there is some residual stuff here that I have to deal with outside of that. And then I think the other thing too that we need to talk about a little bit is in the dry eye world, they talk about it being chronic and progressive. And I do not like that language at all, because first of all, I don't know that it's true. I don't think it is chronic for everybody. I see people on the boards. I mean, they find something and off they go. I mean, but to this point earlier, off they go. So we're not seeing those folks posting anymore because they're happy and feeling good and they don't need the support anymore. But it would be nice to keep those voices as part of the conversation, because I don't think it's a small group of people. The other thing is the progressive thing. Progresses to what? I've been dealing with this for like 15 years and I still don't know. But I know that I'm still sighted, and I know that there are still things that can help me. So I think the language around some of this stuff is really kind of ominous. And I think we need to talk about that and recognize that it doesn't mean anything ominous necessarily. But it alarmed me, as I'm reading this. I'm like, chronic and progressive sounds terrible. Like, what does it progress to? Maybe nothing. I mean, maybe this is, you get into a state where you stabilize and you have some things that you do, and you get into a routine, or maybe you do get better, you get worse, but you deal with it. But I just feel like they kind of drop that there, and then they, meaning, the internet. My doctors have not spoken to me that way. And as a matter of fact, they have actively discouraged me from my internet because it leads to nothing good. But I would say emotionally that the loss of the driving, and then just as you start doing some of your own reading and finding some of these things that are kind of disturbing, decoding that a little bit, I think is really important.
Well, that's huge. Thank you. Laura and I have been emailing about this whole night driving thing because that's where I am. I hit this point. It's been kind of progressive the last 3 years. I've been gradually losing my night vision, and I'm kind of at the point of, we're, as I said before, working towards cataract surgery, and it's just very complicated. And in my situation, it's like night driving is really important. I'm in the Seattle area. When we get in the middle of winter, it gets dark at 4 and gets light at 8. And this year I have lots of unexpected stuff. We all have lots of unexpected stuff with the pandemic going on. My husband, who's been in assisted living for the last 10 years, is now home. My kiddo, who was going to be heading off to college, is going to be doing college from home on Zoom and doesn't have their driver's license. So life is very different. Driving needs are different. So I'm kind of like pricing out Uber and trying to figure out how that works into life right now. The chronic and progressive thing, that language, that's huge. A lot about language. There's lots about language that I need to talk about, and that's going to be our next question. Briefly, before we head there into the language that doctors use or that the internet uses that may or may not help us or may hurt us, just a couple thoughts about these big emotional hits. Some of those hits are in the beginning or somewhere in that initial process where we're getting diagnosed or getting on a path to treatment. Some of those hits are coming much later. One of the things I've become just acutely aware of over the years is this sort of PTSD effect of what people go through initially with dry eye. I'm thinking of people who went through a really hard time emotionally initially with things, and then they got everything they needed to get. They got their management strategies, they got their treatments, they got everything they needed to manage the impact of dry eye on their life, and they've been doing well for years, and then they regress suddenly. Something changes. Is it their eyes are changing? Is it they changed jobs, or they moved, or they're on a different medication that's maybe increasing the dry eye, or something changed, and it triggers some new symptoms, or just they're repeating some old symptoms, and it messes with their heads really badly because it's just like triggering that whole thing of what I went through initially. Oh my God, am I back there again? It's really hard on people. I've got a friend in France who has struggled, a young person who struggled with dry eye terribly, and then was in a really good place for a couple of years, then regressed, and oh my God, just really, really hard. I talked with someone this week that I've known for almost as long as I've had dry eye, who has been doing great for many, many years with scleral lenses. And then some stuff happened and the lenses aren't working well for them. And they feel like they're right back to square one, and it's scary. So those hits can come in unexpected places. I mean, we know, I think, when we've got this going on, that things are going to change. It's never going to be static. We're going to have flare-ups. Stuff is going to happen, but we have to be prepared for those emotional hits when stuff does happen too. Okay, so we're going to move on to the language thing. So our second question for all of you is, what role have eye doctors played, for better and for worse, in the mental health impact of dry eye for you? So this is going to be all about things a doctor told you, or an impression that they gave you that was high impact for you. Okay, Rob, you're gonna start something.
Well, this has been an undercurrent of many, many, many conversations Rebecca and I have had. And just sitting here, I'm thinking that probably being a New York City resident made this aspect of things easier, because whenever any of us get together, we talk about depression and antidepressants. It's before we order appetizers. It's just part of the discussion menu around here. So like a lot of people at the beginning, you're going out and you're meeting tons and tons of doctors, trying to get a handle on your situation. And in my experience, many really good eye doctors don't even want to talk about the other parts of the eye that they're not experienced in. You want to talk to a meibomian gland doctor and ask him a question about your cornea, he'll say, you got to talk to an anterior segment guy about that. So forget about talking about depression and mental health and the fact that this, with the onset of these problems, no matter where they came from, it's not, they don't schedule themselves into your life between 3 and 5 p.m. They touch everything that you do, your job, your personal relationships, et cetera. You guys all know this. And you also probably know that the people in your life who love you will be sympathetic and will help you in the ways they can, but it's just not something that that a lot of people are going to explain. So I have some things that I want to say a little bit later about finding social workers or psychopharmacologists or psychiatrists to talk to. But I think what I really want to get off my chest here has to do with medication and the fact that really, really good eye doctors don't want to get involved in your mental health issues, and that if you start exploring antidepressant usage on your own, one of the first things that you're going to see, and one of the things that they're going to tell you, is that, well, there are potential side effects of this SSRI, or this whatever, this antidepressant. It says right on the label, a side effect is dry mouth. So you sure you want to be putting that, your mouth is so close to your eyes, there are these issues. And the most helpful, marvelous eye doctors who I worked with over the last decade, in general, were opposed to having a discussion with me about antidepressants. But again, you're dealing with this 24/7. I got to a point a year or two in, I remember I was on my way to work one morning. I mean, the day was barely brand new. I had one subway stop to go from Queens to Grand Central Terminal, and the subway got into Grand Central. I couldn't get off. I couldn't stand up off the seat. I was so overwhelmed with dreading what I was with thinking about, oh, am I going to need cataract surgery in 30 years? And how am I going to deal with that? And how am I going to deal with this assignment that I have today that's due at 5 p.m.? You just kind of shut down. And that is an example of depression and how it affects you. And I was going back and forth, to see my doctors a lot and talking about this. And finally, sometimes you can manipulate a situation into getting someone to tell you what you want to hear. And in this case, I found, and I'm going to go out on a limb here and say that in my experience, I found this broke down a little bit on gender lines. I arranged a phone call with a doctor who I knew my doctor respected, and somebody who I had worked with on some LipiFlow clinical trials around that time. And I said, look, can we just talk on the phone about this? I'm having these problems. I get that the doctor doesn't want to talk about it, but I don't think that I don't have the energy to get up to Boston to see you. I can't, I'm having trouble nourishing myself. And this whole long conversation basically boiled down to, you may for a while need to think about this as what's the lesser of two evils. All right. And that was kind of what I really wanted somebody to say to me, because it was permission for me to start exploring things outside of my eye doctor's office, not to be secretive about it, but to just say to somebody who was really my lifeline and who's been my lifeline for 10 years, I'm doing everything you say and I'm following everything you do, but I got to say on this one area, I have to give a little pushback. And to his credit, he said, okay, we need to know that. Well, we'll put it in your chart. Wasn't a conversation that he wanted to have. And by the way, the doctor I'm talking about isn't a huge fan of medicine, of ophthalmic medicine. He doesn't want to talk about cyclosporin. He wants to talk about root causes of MGD. And if I missed that before, that's my big problem, right? My glands are all clogged, so I have lipid deficiencies and evaporation issues. And one of the things that I learned, and I think it's really important to stress this, is that no matter what you start to, you have a psychopharmacologist who is perhaps a psychiatrist who's an expert in prescribing medicine. But then on the other end of the spectrum, you can have a licensed clinical social worker. A lot of this depends on who you have access to through your insurance, who you can see, a psychologist, whatever. Nobody prescribes medication for depression and hits the bullseye on the first shot. It doesn't work that way. It's an art. It takes tweaking. It takes monitoring. It is a time commitment on top of going to your eye doctor and on top of going to your job or whatever you're doing. It's more common than not, in my opinion, that people need to try at least 2 or 3 different medications to find something that works. And then as they're monitored over the years, you may find that you're taking too high a dose or too low a dose. You need to assess what the side effects are. And you obviously need to be considering, okay, is this making my eyes worse or not? And you need to have full candor with your doctor, obviously. But I hated the fact that I was discouraged from pursuing treatment with medication. And there are a lot of people in this world whom I have in the dry eye world, who want to be on as little medication as possible. And I aspire to that. But I also aspire to being able to get my ass up off the subway when it gets to my stop. And that was, pardon my French, what really helped me when I started exploring that, and I found a medication that was working for me. And if, Rebecca, is it okay if I just say what it is? I mean,
absolutely, please.
I started taking Wellbutrin. The generic is bupropion. It happens to be at a much smaller dose the active ingredient in, I believe, in Zyban, the stop smoking drug, and it also made me stop smoking, which was a nice side effect. To this day, if I'm walking behind someone in New York and they're smoking a cigarette, I have to cross the street. It just makes me nauseous. But bupropion, it's not an SSRI, I believe. It's an old drug. It doesn't have a lot of the side effects that some of the newer drugs have. But what I have found, and Rebecca knows this because she's met me and she's spoken to me enough times, I pretty much go through my day feeling as if I'm plugged into an electrical socket. I have more energy than I know what to do with. And it is far, far more preferable to how I used to go through my day, to the point where last year we lowered the dose by 1/3 because I was just a little bit popping up all over the place. And I think I left all these notes for myself on points that I wanted to touch on, but I did. I touched on them. That's
Okay.
what I want. Was I not clear about anything?
This is great. Thank you. On this point about eye doctors discouraging the use of antidepressants on the basis that they may worsen dry eye, this is a thing that honestly, among many other things, really angers me. Some of you know that I had the privilege of being part of the TFOS DUCE 2 project several years ago, the big international medical consensus thing. I was on the education and awareness subcommittee for that, and we met in New York. That might have been when I met Rob several years ago. And this thing came up in conversation amongst our committee. And I was like the one there that wasn't a doctor. And we're talking about this thing about dry eye and antidepressants. And it comes up, oh, well, dry eye, antidepressants make your dry eye worse. You tell your patients not to use that. And I spoke up very loudly then saying, wait a minute. There comes a time when your head hurts more than your eyes, and it has to be dealt with. This is important in dry eye. That on the one hand. Secondly, something I've been thinking about much more recently is how inappropriate is it for an eye doctor to tell us what psychotropic medications to use or not to use, period. Have any of you ever experienced an eye doctor telling you, well, don't use your blood pressure medication because it might worsen your dry eye? I don't think so. Have they told you to use some other medically necessary medication because it might worsen your dry eye? No. But they have no problem telling you to not use an antidepressant or an anti-anxiety med because it might worsen your dry eye. Well, that's just plain wrong. They got no business meddling in the meds that help improve your overall quality of life. I don't know why the psychotropic medications are picked on in the dry eye world. In my view, it's just absolutely inappropriate for an eye doctor, optometrist, ophthalmologist, I don't care. They should not be giving you advice about medications that have been prescribed for legitimate reasons unless they are consulting with the doctor that prescribed them.
Which is not going to happen. May I interrupt on that?
Yes,
on that note? Because Rebecca, you and I just spoke recently about this. You know, on the spectrum of mental health providers, social workers, psychologists, psychiatrists, psychopharmacologists, there isn't a segment of the industry where there are doctors who specialize in people with eye problems. But there are, and because in my dream life there would be, but there are professionals in all of those arenas who specialize in, who have experience working with patients in chronic pain. And that may be good enough for you to get started on where you need to go. Because when I sat down with the LCSW that my insurance provided for me and that I had a referral to from a friend, I liked him, we related. He had no idea what I was talking about, but he had enough patients whose lives were shaped to some degree by a medical condition that had nothing to do with ophthalmology that we could talk about it. And that was pretty key.
Okay, Mandy, you want to say something about medication?
Yeah, sorry. And sorry, I keep on, Bella, get over here. My dog is like following a dog right now. Sorry. That's why I got up earlier. She was like about to tackle the male person. So I am on I want to say the word, S-load of drugs. I, like Rob, I'm like, whatever it takes to get me through the day. And I think my eyes are so dry as it is that I really don't notice any difference, honestly, taking any of these meds. But I do notice a difference in my interactions with people and how my brain is working throughout the day. So I am going to do what Rob did and say a few of the meds that I'm on that relate to the depression, anxiety aspects of my condition. So the first one is not specifically for the anxiety, but it's supposed to help with it. I have some trigeminal nerve issues, which make my left eye much more sensitive than my right. And so I take gabapentin for that. And then I take sertraline, and I take a pretty high dose. That one does not work for me on its own, but my doctor, who I absolutely love, she's a PA and I'm in love with her. She's like the best doctor. She goes through everything with me, the side effects, like, let's talk about this, we'll try this. And she suggested that I take lamotrigine in along with the sertraline. And lamotrigine is a bipolar drug. That is what it is made for. And I'm sure a lot of people are going to be like, I'm not bipolar. I mean, although you see my fidgetiness, so maybe you think I am. But I have found that adding that into my routine has really helped calm me. Like when I was taking sertraline, I would have to take 3 lorazepams a day, which is a benzodiazepine, which is also like something they put on the drug spectrum, like opioids, avoid this. And I don't have an addictive personality. Like I just like beer. I just, I can control myself, but I don't have an addictive personality. So like if I could take 3 a day, most days I would just take 1 when I really needed it. And I just have to say, just try it. Don't be afraid. I mean, I'm not pushing drugs, but just like try. Don't be afraid of the dry eye side effect. And most of them, it is a minimal percent. I think that it's a very small percentage. Like Rob was saying, I think it was you that said this, the dry mouth. Was that you? Yeah. So the dry mouth, that is often an indication on some of these antidepressants and anti-anxiety meds. But dry eye isn't always in there. And then if you dig deeper, you might see, 3 people were impacted, like they thought their eyes felt drier. And so they'll, sometimes look deeper and say that. But I just think it is so hard to deal with this. And trying to be pure in taking meds and trying to battle through it without. More power to those people that can. I can't. So I need these. I don't feel like it impacts me more with my dryness. I feel like it has helped my relationships with people. And I think that's one of the later questions. Anyway, so I'm not a drug pusher, but I am an advocate for making your mental health better while you're trying to deal with this.
And may I add something to that?
Briefly, yes.
Yes, I'm sorry. The doctors cautioning people against mixing antidepressants in with their eye treatment, these are coming from entirely well-meaning places. These aren't doctors who have a problem necessarily with that level of medication. They're just trying to create as pristine an environment for their own work as they can without it being messed up.
Absolutely. I don't think it's because they're not thoroughly well-meaning. I'll never forget that moment. I was sitting there in New York with those, 10, 15 doctors on this panel and raised my hand and said, wait a minute, sometimes the mental health impact is large enough. We need these meds and screw the impact on dry eye. I had a lot of faces turning towards me going, oh, really? And there's a need more for education than anything else, I think is the case in dry eye. Okay, so we've talked about medications and things quite a bit. I'm going to go back to this original question of what role eye doctors have played, for better or worse, in the mental health impact of dry eye. Are there things doctors have said to you that tanked you emotionally? Are there things doctors have said to you that helped you emotionally? What role do doctors play in how we feel about our eyes? Christina, can you grab this?
Sure, thank you. And I think there's definitely some tie into what Rob and Mandy have said as well. So, and Laura, I mean, honestly, all of this has been so validating for me to have a conversation with people who understand, as a side note. But for me, Laura, when you said the chronic and progressive, that was so spooky, because like that is exactly what the doctor who diagnosed me with MGD in 2017 told me. So, you know, boop, 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 they do all their little tests, their fancy little tests, and then the doctor swoops into the room and introduces herself, and then that's basically all she told me. It's like, this is MGD, it creates these symptoms, it's chronic and progressive. Here's a list of 1,000 things that you can do to take care of it. And I was like, huh, okay, interesting. So those words, setting chronic and progressive, they carry so much weight. And, you know, I remember a couple months later having my optometry appointment, my annual optometry appointment, and the doctor I mentioned who I was seeing, the ophthalmologist I had seen about dry eye, and he's like, "Oh, she's the best. She's an expert in dry eye. You know, you can't get better than her." And I was like, "Okay." So for a little while, I was able to justify how sitting with those words made me feel. I was like, "Okay, well, if she's the best, maybe that's what she meant to say, and you know, maybe that's okay, Rebecca, kind of like your experience." But with time, sitting with those words, I realized, no, that's not okay, because there seems to be, you know, no, what's what I'm looking for? There seems to be no understanding of the patient experience. It's kind of like we throw these words at you, and good luck. you know what they mean, so take them as you will. And
No
so
bedside manner.
Yeah, shocking. So it's really interesting from the mental health standpoint of you know, them saying these words to you, the impact they're having on you personally, and yet I find it very interesting after that, after being given a life-changing diagnosis. I mean, granted, again, it could be worse. You could have some cancer or, you know, many other chronic progressive conditions, more painful conditions, but there's no follow-up after that. They simply leave you with those words, and there is no, at least in my experience, there was no recommendation of, hey, listen, this is my specialty. I've seen hundreds of folks like you. I would highly recommend a counselor, a psychologist, psychiatrist, whomever they may be. I highly recommend this be part of your journey. It's simply, you're in, they tell you what they tell you, they give you the list of things, and then you're out the door. And so that to me is a big piece of this puzzle. Like, I understand that there's so many things about our healthcare system that are messed up. And it with all the specialties that we've created, they become so siloed. And so there's just no communication between any of them. And so as a side note to all of this, professionally, the work that I do, I'm in digital marketing, and I do some social media work. So the organizations I work with are in the caregiving and end of life space. And so with that, I've learned a lot about palliative care. And so now I'm taking what I've learned about palliative care, and I'm thinking there's got to be a way, because palliative care is for patients with chronic pain, and we're managing that chronic pain. There's got to be a way to create a palliative care team for people living with dry eye. We may not have cancer, we may not have many other chronic conditions, but this is still very painful and affects us on so many levels. And so I would love to see some sort of team, some sort of interdisciplinary team that's created around the care that we receive. So you get that follow-up, you get a recommendation to someone who can address, in this case, the mental health aspect of it. So you're not left on, I fortunately figured out quickly. I said, yes, I should see a counselor, but that's not going to be the case for everyone. Not everyone's going to find that information or to think that, and for that to be an accessible option. So that's what I want to say about that. But I think that kind of ties into the what Amanda and Rob were saying about the medication aspect of it. There should be someone in the process that also helps coach you and manage that piece of it as well. That's what I'd love to see.
Someone that can coach you and manage that practical piece. Yeah, absolutely. That's a big, huge piece that we're missing. Yeah, I'm thinking of a medical event, quasi-medical event, marketing event, I don't know, an event associated with medicine that I went to back in February this year. That was about dry eye specifically, and it was educating doctors in how to kind of make dry eye the big thing in their practice. And one of their directions to these doctors in terms of how to build a dry eye practice was specifically, explicitly, and universally to always tell everyone that their condition is chronic and progressive.
Yep.
And
you and I had touched on that in our conversation before this, is just how it seems to be. I don't have a pulse on that as probably as closely as you do, but there does seem to be within the industry that dry eye is kind of marketed as this thing that not only you can make money on, but that you should push people toward. And anyway, I'd love to hear more of your thoughts on that.
I think the important thing that we have to keep in mind when we hear that kind of language from doctors is the difference between the distinction between the medical aspects of the condition and the symptoms and quality of life impact. Because a disease can be chronic and progressive. That does not mean that its impact on our life is chronic and progressive.
Right.
We can get the tools and techniques and strategies we need to manage the impact on our quality of life day to day, even if our disease aspects do get worse. But I absolutely agree with this thing, that with the questioning of chronic and progressive. Dry eye is not one thing. Dry eye is this incredibly stupid, great big bucket of it's a generalization about all these different conditions that just get lumped together and called dry eye where they really aren't. Some of them are things that are solvable. Some of them are things that will go on and progress. Some of the autoimmune conditions and things. But the generalizations about the progression are not helpful to us. And just, I think that we all have to keep in mind this difference between where we're at clinically, what a doctor sees in our eyes when they look, versus what are we actually experiencing? What's impacting our daily life in our work and our social lives and getting through the night with dry eye? There's just a really big difference there. And I like what you called out about the siloing effect of just things getting narrowed down too much. We really have to look at the big picture with dry eye. All right, Laura, anything you'd like to add to this about the language or anything else in the doctor's role in our mental health?
Yes, because I think this is the ticket. I love my doctors. I have the best doctors, and I had great doctors in Chicago. I moved to Seattle. I knew very quickly I had a problem because I was seeing at night. I was panicked because I didn't have a doctor here. The first doctor I went to, who was highly regarded and recommended, basically looked at me, told me I needed a double cornea transplant. It probably wasn't worth it to operate on me. It was a pretty depressing conversation, actually. It was basically like, there's not a lot we can do for you, and the things that we can do probably won't work. I mean, it was a horrible conversation. I left really depressed and kind of hopeless. My husband was with me at the appointment. Then I was reading a newspaper and I found an article about another cornea doctor and doing some humanitarian work and things like that. And I pointed to the article and I said to my husband, this is the one. This is who can help me. And we went to the appointment together. And at this appointment, my condition was exactly the same as it was at the first appointment, but the conversation was completely different. It was, yes, a surgery will help you. I know that you're in pain right now and that you need help, and I can get you in 2 weeks to get this done. And what you have is, we can work with this, and I can do, she says, I as a doctor can deal with this. It was I know I didn't improve between the 2 visits. So this was a completely different shift in how my problem was viewed by 2 highly regarded ophthalmologists. Needless to say, I'm with the second ophthalmologist still. And I will tell you that the language that doctors have used that has been talked about here has not been used with me in that way in my appointments. I can tell that the way information is disseminated to me is very much kind of on a need to know basis. It's always dealt with, like a sensitivity, and, she'll answer every question that I have, but will not let me go down the road of kind of despair and anxiety and all the things that can happen. And sometimes I'll just say, am I okay? And I mean, clearly I'm kind of not okay. I mean, I have a lot of eye problems. I mean, I've had 10 surgeries. Like, I'm clearly not okay. But she knows what I mean by okay. It means, am I still going to be able to do the things that I care about, except for drive at night, but that ship has sailed. Am I going to be able to keep my job? Am I going to be able to do the things I want to do? And she looks at me and she says, yeah, you're okay. And that's all I need. And then I can go about my day. I can go about my life, and I'm fine. But that serves a huge mental health role for me. And because we've been doing this so long together, it's almost like it's a predictable sort of interaction, but I need to have that interaction. I see her every 3 months, sometimes more often if something's going on. And it's very centering for me, and it makes me secure. It makes me feel like somebody's got me. And I think if you have a doctor that doesn't get you, you need to get one. And because I'm telling you, even the brief interaction that I had with that first doctor was so demoralizing. I can't even imagine having that interaction every 3 months. And I told my husband, I said, this cornea deal is different than any other doctor I deal with. I have to like this person, and the person has to like me. I mean, we have to get along. It's not a lot of doctors you don't have to get along with. They just have to be able to fix the problem. This is a relationship, and it has to work. And he said he now understands it. He didn't initially understand how important that was. But I've had this problem in the optometry sector as well. The first optometrist that I went to here treated me like a circus act when I came in, would call in like the, students who were in the office. Oh, look at, we've got like every rare ocular surface problem and what, and I finally said, look, I can hear. I can't see that well, but I can hear, like, you're not working on a cadaver. Like, I can hear you. And, I began to understand the importance of doctors not being reactive. I mean, people will look in a slit lamp who've never seen me before and gasp when they look. My ophthalmologist, it's like a walk in the park on a Sunday. I mean, she's very non-reactive about it. And so that helps me to be non-reactive about it, because I take my cue from her. So I told her, I said, I'm going into these optometrists' office and they're acting like the freak shows in town. And like, I can't deal with this. Like, it's making me crazy. So she gave me a referral to an excellent optometrist who sees a lot of her patients. So is used to seeing kind of a high level of abnormality, doesn't react. And I have another optometrist that I use for my sclerals, same level of professionalism, totally non-reactive. I know they don't see people like me every day. But I'm telling you, if I didn't have these people in my corner, I would not be functioning. And I'm not understating that. Having the right team to do this medically is everything. And if you don't have somebody in your area, I know like specialists are not like, so there's not a million people doing this work. Find some way to connect with somebody, even if you have to get a, go kind of, even like the boards and stuff. I mean, just find some way to get the right support around this, because I mean, I can sit here and be like, oh yeah, I'm fine and I'm handling all my problems, but that's really not authentic. Because the reason I'm in the place I'm in is because of the support that I'm getting. And I cannot, I mean, and I have never had the medication conversation explicitly with my ophthalmologist. I did once ask about alcohol and dry eye, and she was like, can't hurt, might help. So she was not supportive of that. So my feeling is if I went in there saying that I felt like I needed something more, I would get support for that. So I also want to say there are medical professionals out there who aren't denigrating some of these other things and are sort of them. They're out there. I just wish there were more of them. But I am telling you, I mean, I have every eye problem in the book. And if I didn't have the right doctor, the mental health side of this would have done me in completely a long time ago. So it's just, please keep looking for the right doctor until you find them. Because it makes all the difference, truly. That's worth, because Rebecca, like what Rebecca's saying, it's a lot of times it's really not the eye issue that's the problem. It's the anxiety around it. What's going to happen to me when I get old, or what's going to happen to, all these things. And you really just have to step back. And first of all, the world 2, 4, 6, 8, 10, 20 years from now is going to look totally different to this. I mean, the scleral lenses that I'm wearing now were 2017 was when Boston Sight started making these. So that's not that long ago. There's stuff coming out all the time that's changing the landscape of this. So I try to really, when I get into that place, just say it's not even a productive exercise to think about, the future we're off relative to this, because it's going to look nothing like it looks today. I think almost every single thing that I use didn't even exist like 10 years ago. So my gosh, 10 years from now, who knows? But anyway, I just wanted to say I love my doctors and they should bill me for the mental health. I bring them baked goods as payment for the mental health. but they're wonderful.
Yeah.
Huh? What, Rob?
I bring bagels to Boston. It keeps me in good
Oh, no, that can't beat that. But I just want people to,
sorry.
But I just want people to know that good people are out there and you just have to find them and it will change everything for you.
That's really good advice.
Oh, wow. Thank you. That was so good.
Can I add one thing? It'll be short.
Yeah.
I promise. I've been on a few of these, so I don't have to say much, but I have in the past. So specifically my doctor, I haven't found a good one in Madison. Like I found ones that try to push a lot of the technology that's out there and pay for it. And then I have my doctor from the university who is the corneal specialist that everyone said see for dry eye, but she's so busy and overwhelmed. I'm not bragging about this or anything, but I'm sure all of you experience this. You're educating your doctor on some of the things that you read about and dry eye. And she's like, oh, I hadn't heard of that. And I'm like, yeah, I read about this like 2 years ago. And so it's hard. It depends where you live. It's hard to find the right person. I did find a doctor who lives in Minneapolis area through a friend of mine who's an allergen rep. And this guy is awesome. He is not an ophthalmologist. By training, he has some extra training on top of his optometry, but he like does a lot of dry eye work, and he has actually been probably, besides Rebecca, the best thing that I found for assistance in dry eye. We're LinkedIn on LinkedIn, and we will message on LinkedIn all the time. I have a question. I mean, lately, not so much, but if I have a question, he'll answer it. If I am curious about something, he generally knows about it, and we talk about it. He will help me to understand if that thing might work for me, in his opinion. He's very honest. I have a really good relationship with him, and that is incredibly helpful. I wish he was closer so I could see him on a regular basis, but I did go to undergrad in Minneapolis, so it's kind of nice to get back every once in a while and have a reason to go back. So yeah, it's really important to find a good doctor. It actually saddens me when I go to my doctor here sometimes and I just get everything looks great, your corneas look great, so everything must be great. And
That mean?
bye, see you in 3 months. What, Christina?
It's like, what does that mean?
I know. Yeah.
One of the things that you touched on, Laura, was what are the key questions here really that are in our minds? I mean, when the doctor looks at you, they're looking at what do they see through the slit lamp and what does that mean to them? But for us, it's these fundamental questions, like you said, Laura, am I still going to be able to do the things I care about? Am I going to be able to keep my job? Those are core things for us. Doctors got a different perspective, different priorities. And honestly, for us in the dry eye world, we have this incredible spectrum. We've got people who are on one end of the spectrum with severe corneal disease. Doctor looks through the slit lamp and they gasp, like you were talking about. And that's scary. On the other end of the spectrum, we got people with severe discomfort that may or may not have any visible disease going on. And when the doctor looks through the slit lamp and says to them, gosh, you look pretty darn good, and yet they're extremely uncomfortable and something's messing hugely with their quality of life, that's equally disconcerting to them as the gasp is to someone with severe disease, because for them, it just doesn't compute. It's like, if I'm having this huge impact on my life and yet I look great, what's wrong really? What's going on? Am I nuts? Am I not coping well? Or do I have this rare disease that nobody's diagnosed? There's just this huge wide spectrum, but at the end of the day, we really all need a doctor that we can communicate with and we can say, here's my real problem. Here's what's messing with me. Can you help me with this? Years and years and years ago, back on the Dry Eye Talk forum, I wrote up this series of articles about what does it look like to find a dry eye doctor that can help us? And I took it down to this very low bar of they've got a pulse and they'll engage, they care, they will go to bat, they will fight for you. They will, whatever they're seeing through their slit lamp, they will listen and hear a person that's got a problem and try and help find the answers. They may not have all the knowledge and the answers themselves, but at least they will look. Wow. Okay, I'm looking at the time. It's 4:36. Aiden, can you see, is there anybody that wants to be added into the conversation here that we can turn on their audio video for?
Yeah, anyone, we have a few people here. If anyone would like to kind of join the video conversation, raise your hand and I can promote you.
Somebody asked a question about sclerals in the questions. Are they still around?
I don't know. It was an anonymous question, but I think we should address it anyways.
I'm going to check out for 2 minutes. Can you guys feel this?
Yeah.
Okay.
Yeah. So the question is, can those of you who had scleral lenses talk about your experience, pros, cons you've had? So Rob will probably have more than me because I'm fairly new to it. The pros, as far as I know and can say, if you have irregular corneal surface, this is the one and only, I think, vision correction, really good vision correction option that you have. And like Rob was saying, correct some of those higher order aberrations that are not amenable to glasses or soft contact lenses. They protect the eye, they keep the eye hydrated and moisturized when you're wearing them. They're really good for your ocular health, which is great. They have a therapeutic function as well for those of us who do have ocular surface or dry eye disease. The cons of them, I mean, the first and most obvious one is the expense. I've not had great luck getting them covered by insurance. I'm continuing to try to get them covered, but they are very expensive. So there's that. Getting the fit right can be difficult. I have a skilled optometrist who's done a really great job with it, but it does take a few tries. There's also just a lot of, Rob alluded to this, a lot of materials with them. There's plungers, there's solutions, there's all kinds of things. And before I had them, I was very tempted by reading the boards. People are talking about all these different solutions, the neutrophil, the sclerophil, the Adipax, all these different things. And I'm like, my head's blown up. I'm like, I am never going to understand this. But the truth is once you get into it, it's actually fairly straightforward. It's not that complicated. I'm certain you do other things in your day that are more complicated than this. So, and the cleaners, I mean, again, once you know what cleaners you're supposed to use with the coating that you have or don't have, not a big deal. And the insertion, does take some practice. Take out stock and scleral fill, because I've gone through about 8,000 bottles trying to learn how to put these suckers in. But I'm getting better every day. I would say I'm medium good at it, not great, but I'm getting better. And again, it's just patience and time, but my God, are they worth it? I mean, if you can get through all of the kind of speed bumps to getting them, I've never seen so well. I mean, I see really well with them. I've actually purchased a lot of skincare products since I've had them because I can actually see my face again. But I think they're wonderful. My eyes feel good when I'm wearing them. I don't like taking them out at the end of the day because I feel the nodules and all the activity on the eye as soon as they're out.
Well, can I ask how many hours a day do you usually wear them? What sort of wear time?
All day. All day. I
That's
put them in when I wake up and I take them out when I go to bed. And if they get a little dry, I just, I spritz them. So no, I love them. I think they're great. But here's the other thing I know about them. They don't work for everybody. And so everybody with this stuff has to find their thing. I've tried, Rob talked about the amniotic drops. I tried those under a different name. I'm not remembering the name. Genesis, I think they were called.
Yes.
I used those and they didn't do anything for me.
How long you
but
used
apparently they've.
I'm sorry, I don't want to derail you, but can I ask how long you used that for? How long did you try it? The Genesis?
I used them for a while. Months.
More than a month? More than a...
Oh, yeah.
Okay.
So they didn't work for me, but they have worked really well for other people. So I guess what I'm saying is don't hang all your hopes and dreams on any one treatment either, because there's just so much out there. And I think that's where people, I'm sorry, I'm cycling back to the mental health thing, but I think that's where people get depressed, is they think, like, there have been periods of my life where I couldn't even turn on the lights in a room, or when I woke up in the morning, I couldn't even turn on the lights in the bathroom because it was so blinding and painful for me because of what was going on with my eyes. And in those moments, it feels like you're going to be there forever. You're like, I don't know how I'm gonna get out of this. Now, fortunately, again, I have a surgeon who says, this is how I'm gonna get out of this, and we get out of it. But then when I get out of it, it's very easy to forget what it was like when you were in it. And then you go back into it, you know, because the nature of my issues, they tend to be recurring. And I think that's a big mental thing too, is you have to remember the coping strategies you used when you were in it and go back to those, but not to think it's going to be forever, because it's not. There's just so many things out there that you can try. I don't know if anyone on the panel here has hit the end of what's available. I know I haven't. So it's just always something to remember.
We live in a golden age of treatments for this. 10 or 12 years ago, you couldn't find a doctor who could offer you LipiFlow, IPL, heated gland expression. At one point, I was traveling to Toronto for medical care from New York. Really, in the last 10 years, doctors have started to figure out that there's an economy here and that there's a lot of people who need help.
Really, I think we can thank Allergan and Restasis for that, because it's basically Restasis having been this incredible blockbuster drug that made so much money for Allergan, that woke up an entire industry to the fact that, oh gosh, dry eye is a thing. And now
talk about the things that Allergan has done to preserve their patent, like the Native American. Now I won't go down that road. Okay.
Yeah, it's okay. So anyway, there's lots of things in development, and really in the last 10 years has been all of the science of sensation and eye discomfort, aka pain, and what it means, and all the different guises that it comes under. This science is developing now. It's emerging science, really, and there's so much more coming down the pipeline to improve our eye comfort stuff. Gigi, thank you for joining. Tell us about yourself. Where are you at in dry eye, etc.? What do you got?
Hi guys. It's really nice to join you. I've been actually creepingly just watching, so I'm glad to be a part of this event tonight.
Thanks for watching.
Yeah, and nice to meet you as well. Thanks for talking.
Thank you guys. I appreciate all you guys sharing your stories. So I am coming to you from Southern Illinois. I was diagnosed with dry eye officially in March of this year. But I remember having symptoms as far back as like about 8 years ago or 10 years ago. As far as what I thought it started out as, I think I was young and dumb, maybe the tanning bed booths, and maybe that might have had something to do with it. But again, I really can't confirm that. So that's my theory, and I'm sticking to it. I have to have something to blame for this thing. So it's a beast. A little overwhelming. What am I drinking? I've got my little hiking water bottle. It's called the Platypus. So I've got water in here right now, but I will be having an adult beverage later. So just keeping it short for you guys. I know you've talked a lot, and I don't want to keep you, but basically I went up to an ophthalmologist up in the Chicagoland area, and they did all the fancy tests. And right now I am doing serum tears, and I am doing some methylprednisolone eye drops for the inflammation. I'm curious about the scleral lenses. That's part of the reason why I asked. But right now, mental health's pretty poor, pretty crappy. So when I got this email about mental health and dry eyes, 6 minutes before this panel started, I was thrilled. So I had to jump on. So yeah, so that's where I'm at. I'm really happy to have found the group like you guys. I didn't know it existed, but I'm thrilled, and I'm hopeful. I think a lot of what you guys talk about in the medical field speaks to me. I'm actually a physician assistant down here in Southern Illinois. I just graduated, so I'm in the field, and it's good to hear you guys talk about what's worked and what hasn't worked with your providers and everything. So we are listening. So thank you. I'm happy to be here.
Thanks for joining. That's great. You mentioned being on serum and pred drops. That really excites me, honestly, for somebody who is relatively new to this, because that's been its own huge battle over the last 15, 20 years. Serum drops are this thing that there've been a million studies about it, but it's not a pharmaceutical product. So it didn't have anybody with deep pockets to promote it. And yet it helps an awful lot of people. So it's been a very long journey for the autologous serum drops to become better known, so that more cornea specialists and even just mainstream eye doctors start recommending it for people that are having issues. That's exciting to me to hear from somebody who is really just getting diagnosed relatively recently, but they've been put onto that. It was just such a long uphill battle for many, many years, getting that treatment better known for people. Those of you on the panel, how many of you have ever been on serum? Laura?
I tried them. I think I would have tried them longer if I didn't have to go to Milwaukee for my blood draw and then come back. Just all the appointments that I have to go to add up so much, and it's just weighing the cost benefit, I guess, of it. It just started pouring here. I'm sorry. And I would like to try them again, maybe try the Regenerize so I don't have to go do the blood draw. I also know there's a company that will come send people around to your home.
That's what I
think.
use.
Okay, what's it called?
Vital Tears.
Vital Tears?
Yeah, so maybe I'll try that. I don't know.
Things are twice as complicated right now as they were 6 months ago.
Right.
For serum thing, and neither here nor there, but yeah.
Yeah. So, Gigi, about the mental health impact of dry eye, anything specific you want to share about that?
Yeah. Oh, I've got plenty to share. Well, for the most part, it's been kind of an uphill battle with just doing everyday activities. I think going outside with the wind is like my big thing. It just tears my eyes apart. Yeah, go walking in an air-conditioned building where it's like refreshing and feels great for most people. My eyes will just sink inside my body and it's so painful. So, just doing everyday things is just a lot harder, So I think just dealing with that has been kind of an adjustment for me lately. And acceptance is like a little hard in my dictionary. So I think I'm working on kind of coping with it and doing things that I used to like to do. But it's definitely, it's not easy. And I think a lot of people, if you don't have dry eyes, you don't understand. And so it's kind of, I don't know, I just socially, it's a tough thing to have, I think. At 9 o'clock, I'm lights out. Like I need to go to bed because my eyes are shutting down on me. So I don't know. I think a lot of that piece is socially is tough too.
On the social element of it, I've developed the habit, if I go back when I used to go out to dinner, or you want to talk about being awkward, you're with a group of people and you're going to be the only one when you're all sitting going, I just need to see where the air vents are because I want my chair as far away from the air vent as possible. And I do this on the New York City subway also because our subways are very well air conditioned. If I'm in a car and, some cars have the vents coming up on the passenger side, I have learned that blowing air from a vent, whether it's hot or cold, is my enemy in any environment. And I am sure that I have freaked out any number of my friends and relatives. They just attribute it to Rob's quirkiness. But that's a really good, easy, protective thing you can do for yourself. And who cares if people think that you're being a little bit neurotic? Blowing air will increase the evaporative effect on your eye 3 times faster I'm making that up, but a heck of a lot faster than it will if you're not sitting in front of it. So don't sit in front of a fan if you can avoid doing that, right?
Andy, talk to us about fans.
No, let's talk about moisture chambers. So this is what I did last time. Here's my dorky, what I wear while I'm working on the computer. They're brilliant. They look like crap, but I don't care anymore. And I sit at my computer with these on all day. If in the winter we want to have a fire, sweet, let's have a fire. These are prescription clear lenses. I have prescription sunglasses. I want to enjoy the fire. I'm going to put these on. And car, same thing. Rob wants to talk, I can tell.
I just want to add to that, Rebecca, I happened to have reason to be in touch with Scott Kornfeld in Hicksville on Long Island this week because the eye doctor in New York, Dr. Farkas's office, asked me if I knew whether he was still making custom moisture chambers. And he is. He was able to find the plastic for the shields, which had been a problem for a couple of years. And he's maybe one of two people. So you've got Xienas and your 7 eyeglasses, a lot of products that are available through you. But if you have a pair of ordinary glasses that you want to have turned into moisture chamber glasses, there's a great guy who does that in New York.
I'm going to come see you and go to that guy.
I will be glad to introduce you.
I told Rebecca that we should all start a company that designs much better looking moisture chambers.
Oh, dear God, boy, should we. Absolutely. I remember I was talking at the very beginning of this session about just kind of my ancient history with dry eye, but I remember way back in the beginning of the time when there was just nothing out there on the internet about dry eye, there were just a couple of sites. There was one called agingeye.com or something like that, and there was one that was like eyepain.com. I forget, I'm going to tell you the URL's wrong. But on the eyepain one, there was this reference to Scott Kornfeld and his custom moisture chambers way back when. And here we are all these years later, and he's still one of the few that actually does them.
He started doing it because he had a Sjogren's. He's not a doctor, he works at an optician's office. But he had a client come in with Sjogren's and needed this problem, and he sort of he figured out what to do. I'm very fortunate because he's a 45-minute Long Island Railroad ride and a 1-mile walk from the station. I don't even have to get in a car to go see him, but I know people have traveled to see him. The problem, and where Mandy, not Amanda, you prefer Mandy, where to do a really meticulous job creating moisture chambers, you kind of need to be there for the last step because he wants to cut it to fit the exact contours of your eye to sort of make it so that give a little space here so you're not having a fogging issue. Gee, anybody else having big fogging issues this year? Right? But for those of you who maybe, if it's too much of a ridiculous thing to get out to see someone who makes them custom fit, your local Harley Davidson dealership will have a window display of 7 eyeglasses that you can buy because they're made for motorcycle riders, but that the company can put a prescription in. They can even do bifocals. I just had a bifocal pair made for myself.
These are Wiley X, which they also do at Harley.
Which
So
introduced me to, and I know that you've got a lot to say about that. But
I swear to God, we're in 2020. Technology is a point where we ought to be able to do just 3D printing of moisture chamber glasses. We ought to be able to get on a website that scans our face as we just turn side to side, create something, and send it to us 3 days later, right?
yes.
The technology's there.
The technology is absolutely there. It's going to be up to us as a community to go knocking on the doors of the people that can do these things and say, bleepity bleep, do this for us. We need this because we need these lifestyle tools. We really do for the comfort side of stuff. We just absolutely do. But I'm just so that the whole eyewear thing is huge. And I love that on all of these, Mandy puts on her moisture chambers and is like, this is what it takes.
I said the last time we did this, that's the number one. That is the number one cheap, fast, easy, and dirty way to manage this problem so that you can pay attention to managing your problem and your life more. Moisture chambers, vanity is the problem when you're 25 and dealing with issues. You know,
I have had to get over vanity big time. I love makeup, love it. Have not worn it in like ages, except for a few times a year. I mean, my eyes were like my favorite thing to do, and it saddens me. And now I wear these, and I'm like, yeah, it looks so cool, you know.
Get over it quickly. I had somebody tell me I looked like a fly. You know, I mean, because I mean they're big. And we know a member here, and I won't name names, but somebody with a very busy life and children, and didn't have the luxury of time to deal with any of these problems. And she and I have been Facebook friends for over a decade. Every photo I see of her, she is wearing the glasses. Every minute she's awake. And I got to tell you, she's smiling in every photo. She's got a happy life. She figured out, all right, this is what, and she didn't spend any of the time messing around with doctors or clinical trials or the stuff that I did. Her life was in a place where, look, I've got to raise my children. I've got to just take care of my family. This is what helps. You know, this is a $150 solution to a really bad problem. And it's been, and she has a great quality of life in my estimation. So
the whole fashion over function, which used to rule my life, it's now function over fashion.
Yes.
So.
And we get to be both. I mean, there's a role for both. And I just have every sympathy for the younger people and older people as well. I mean, I've worked over the years with lots of like mental health professionals who are like, you know, I need to be able to connect with my clients. I can't be wearing goggles. How am I going to have decent eye contact with them and establish some rapport? Well, I don't know. For some of them, it's all about personality, attitude, and powering through and explaining things. For others, it's all about, we got to have better technology tools. We got to have some glasses that look like normal glasses and don't look like goggles that distract people in the middle of things. There's a place for all of these things. But I think that principle of get ourselves some protective glasses, some occlusive devices, we call those in more technical sense, that can just seal our eyes in, improve the moisture, exclude moving air, get us more comfortable. Those really are really super important tools. But we all got our own path to things that are going to make us more comfortable and are going to help us towards a better quality of life and a better mental health place too, which is really the core where we started the whole conversation today. Oh my God, it's almost 5 o'clock.
Yeah.
Like I said, the whole mental health thing could go on forever. Go ahead, Rob.
Interrupt. I want to just thank everybody because this is incredibly valuable for me. And I have a dog sitter whose patience is now exhausted. So I'm going to drop out, but I just want to say thank you for listening and good luck. I'll hope to speak to all of you again.
Great to meet you, Rob.
Yeah, likewise.
Thank you.
Thanks,
Good to meet you.
Rob. All right. Well, I think we need to shut down at this point. This has been really great. I think, and like I said, the mental health part of dry eye is huge. The battles are waged and won on the mental health side. We have to do whatever it takes to get that part under control, whether it's the tools to get pain and eye comfort under control, balancing that with the mental health tools. It's the counseling, it's the drugs, it's the anything and everything that we can tap into that will help us get this thing under some semblance of control. Any last words from anybody on the panel or you, Gigi? Anybody that wants to share something last before we close for the night?
I think
I'll
if
go
I just say
last.
whatever works, it's the right thing, you know? So to not get like a predisposed idea in your head that one solution is right or wrong. If it works, it's right. And to not judge yourself yourself for needing something or for not needing something. And if something's not working, keep looking until you find the thing that does, because there will be something. And go to the chat boards. I mean, the chat boards are like this awesome wealth of information. I mean, there are some downer things that go on the chat boards. And I think what you can't do, though, is let that eclipse everything. I think sometimes people are in a good place. They read like one or two downer things and then they're like, I'm doomed. No, somebody's in a bad spot right now. But that's not prophetic to what's going to happen, you know, with you or whatever. So do whatever's right for you and seek out help. You know, the Dry Eye Foundation is such a wealth of resources. Rebecca personally is an amazing resource, but there's only one of her. So, you know, the boards, the website is one of the most well-developed websites I've ever seen in terms of information. So just don't give up, because there is so much out there. And I don't mean this in a trite way. I mean this very sincerely. It can get better, and it does.
It absolutely does. Thank you, Laura. Christina, any last words of wisdom, things you might advise your younger self?
Yeah. Thank you, Rebecca. You know, I think I would say for people to give themselves permission to feel the feelings and be in those, experience them, honor them, reflect on them, try to understand where they're coming from, whether that's with the support of a counselor or not. Just allow yourself to feel those things, negative or otherwise, but also giving yourself that permission to just, whether it's acceptance or just pushing through, give yourself permission to stop thinking about it. Because I know as many of us probably have had moments where it's just an obsessive thought every, you know, for a week or whatever the time frame is. It's just, you can't stop thinking about it. But there's for your mental health, it's very important to not forget that you have it. You still need to manage it and take care of it, but to give yourself the space to just allow it to be part of the back of your mind, you know, thought, not at the forefront. Was there another piece of nugget of wisdom in all of that? I think that I'll leave it at that.
That's awesome. Thank you. Mandy, any last words?
Well, I'm going to do my normal thing, but first I'll say one thing I didn't mention about my biggest emotional hit was honestly finding the Dry Eye Zone talk board and finding Rebecca and everything that she offers, and Aiden helping her and being by her side for so long, and Chady, right? So Rebecca is like amazing, and finding her has inspired me so much and just given me so much more hope by connecting all of us. And so you should donate to the Dry Eye Foundation. She hates asking for this. So she does all this work. So much of it is out of the goodness of her heart. And she is not in this for the money, but it needs money to run. So there are many ways you can donate. Check out the Dry Eye Foundation site. A few of the ways, one of them that I do is I do a monthly donation through PayPal, which $20 a month. I mean, it's small, but that's where I am in my life right now. And it just automatically comes out every month. You don't have to think about doing it. Another way is through Amazon. You can do Amazon Smile and you can pick a group to donate to. And I do that, and I pick the Dry Eye Foundation. And so a certain part of our, something you purchase goes to the Dry Eye Foundation. It's small, but small things can add up. I think now when you shop at the Dry Eye Shop, right, you can pick a little thing that says donate a certain amount. And there are several ways, and Rebecca has them all listed on her site. And seriously, you guys, who else is providing this to us? So I am not paid by this foundation, but I endorse.
That's the
Thanks, Mandy. That's so sweet. So helpful. Thanks. I want to just, I'm going back to that thing that I wrote 13 years ago that I kind of opened this with today about that dark, dark place and the hard things that we go through. I had 5 things at the end of that thing. This was back on the old Dry Eye Talk forum, which has been around for forever. After that explanation of those hard places that we hit, I had 5 little pieces of advice, and I just want to iterate them here. They were, number 1, know that it will get better. And I think that's something we've heard from everybody here today. Even when the eyes themselves don't get better, even when the pain itself doesn't get better, even when the disease doesn't get better, in those extreme cases, I mean, most of them do get better, notwithstanding all these doctors that tell us chronic and progressive or whatever. Even in the worst case where disease progresses, we get better. We feel better. We get the tools and the techniques and the strategies to navigate better and to cope better and to deal better with life. So things do get better. Number 2, get a dry eye buddy. Connect with somebody, not somebody that's in the same place or a worse place than you are, but somebody who has come out the other side of this. Connect with someone who has been there, done that, knows the ropes, and can give you a leg up in that process and can tell you the things that they would like to have been told when they were at their worst places. Number 3, get help for depression. That's a big deal. Help looks like many different things. It may be antidepressants, it may be counseling, I don't know what it might be, but set out to intentionally get help for depression. It's a big deal. Number 4, don't be afraid to make short-term alterations to your life to accommodate your current needs. I think that's a big hurdle because people look at this dry thing. When you're in the middle of it, you think, oh my God, what's this going to look like in a year, 5 years, 10 years, 20 years, 30 years, 40 years? Deal with the now. It's really okay. Whatever you have to do to deal with now is okay. That does not have implications for what it will be down the road. And then my 5th thing, this is 13 years ago again, was just me personally. I care and I want to be there for people. If you need someone to talk to and don't have somebody else to talk to, don't hesitate to just call us. The Dry Eye Foundation number, just call. If you need somebody to talk to that is going to understand what this stuff is like, just don't hesitate. So here we are. That is it. Gigi, do you have any last thoughts? I'm sorry, I just realized I didn't ask you. Do you have anything to share with us where you're at?
That's okay. I just want to thank you guys for taking the time to be here tonight. I'm very happy to be a part of it. And so I look forward to getting future emails and being a part of more of these discussions. So thank you guys.
Thank you for joining in. And I just want to encourage anyone who's watching this now or in the future. We want people to join in and be panelists on these conversations. There's nothing magical about it. You don't need to be an eye wizard. You don't need to be the dry eye know-all out there. It's really just all about real people living through real stuff with dry eye. We're just trying to have conversations about what is it like to navigate this stuff. So anyone who's interested, reach out anytime. You can call us. It's 800-484-0244. You can email info@dryeyefoundation.org and just raise your hand. Be part of the conversations, which we'd love to have you. All right. Thank you, everybody. That wraps it up for today. Have a good weekend.
You too.
Thanks, guys. Take care.